Okay, so we did a large database study looking at the cost of gastroparesis admissions between 2014 and September of 2023. So we found that the cost of admissions has been increasing throughout this duration, even more than double between 2014 and today's date. This has gone along with the increase in the number of admissions as well. So the number of admissions has also increased a lot. So in 2014, it was around 1,400, and in 2022, it was around 2,500 admissions per year. And these admissions correspond to 42 pediatric hospitals that report to the database, which we use to collect our data from. And we also looked at departmental and regional distribution of costs. We saw that in all regions it was increasing. In addition to the departments, there was also a proportional increase in all of the 6 departments that FIS uses to report the data, including pharmaceutical, clinicals, supply, imaging, labs, and floor services. Thank you for this question. So, as I mentioned, we have seen an increasing trend in the number of admissions and in the cost, including the cost per admission, the mean and median cost per admission, and even the daily median and mean cost. So there has been a significant increase starting February 2020, which we use it as the cutoff date to start accounting for the pandemic. Like before 2020 and after February 2020, there has been a significant change in both costs and the number of monthly admissions. So to report trends of COVID and the number of admissions, we looked at the monthly number, and there was a significant increase by around 15 to 20% in the number of monthly admissions, and as for the costs, they have also significantly increased. So usually, a viral infection is a common etiology for gastroparesis. We have seen it very frequently. However, usually it's a milder form of gastroparesis, and in the literature it says that it resolves within 6 weeks to 1 year. However, with COVID, we're seeing more severe gastroparesis and even symptoms that have last longer. So we have patients who've had gastroparesis after a COVID infection that are still to date following up. It has been 3 or 4 years and they are still symptomatic and their symptoms are still getting worse, which is different from what we usually saw with post-viral etiology. So what we expect that, and as the literature describes, there's a lot of long-term complications of COVID called long COVID. So gastroparesis and functional dyspepsia have been seen as complications of long COVID. And although the mechanism is not yet very clear, we know that there's 2 possible pathways, and it's most probably multifactorial, with 2 possible pathways being either mitochondrial gene alteration and mitochondrial dysfunction, as Dr. Douglas Wallace from CHOP described that mitochondrial gene expression was altered in multiple cell lines in COVID-19 patients, leading to systemic symptoms, and through dysautonomia and vagal nerve dysfunction, as the vagal nerve is the connection between the central nervous system and the stomach, and we're seeing a lot of dysautonomia and vagal nerve dysfunction with COVID-19 patients who develop gastroparesis. So, knowing factors contributing to a lengthier stay can help them understand and manage and personalize the care more. Like, for example, if you know that the patient has a certain complication, you can try to target it more. If you know that this patient will stay longer, you'll know how to care more for this patient. So it will help direct their management in terms of what we hope to achieve one day, which is precision medicine and personalized medicine, targeting specifically what's wrong with them. And although it is like for patients presenting with malnutrition, it is logical that they need a lengthier length of stay to achieve nutritional rehabilitation. But knowing that this might already be the case at the beginning will help patients, like they can get stressed out when they stay longer in the hospital. Putting them at the beginning of the admission at a state where they understand that they might stay longer than usual because they need this nutritional rehabilitation, might have them understand the admission more and understand what they are going through more, which will help in their management.